Study shows suicide is the second leading cause of death in college athletes in the U.S. According to the British Journal of Sports Medicine, the suicide rate for college athletes doubled in just 2 decades. Joining us today is Dr. Alyssa Luker. She is a child and adolescent psychiatrist. I really appreciate you coming in today. Can you first off talk about maybe some of the contributing factors of why we're seeing numbers like this?
Definitely. I think, it's really important to remember that these people are transitioning, a huge transition point in their life. So they're going from living at home with their parents, fully supported, to living independently. So the pressures of that, along with the academic pressures, the pressures of being in the spotlight with the sports as well, I think that contributes. Social media as well. We know athletes spend technically less time on social media than maybe peers of the same age, though with that, they're reading the good, the bad, the positive, the negative. And so I think that can be really harmful as well.
And we're talking specifically college athletes
here,
right?
Yep. So this study was for NCAA athletes. It started in 2002 and ended in 2022.
And it's interesting because you think about these are high performers and they have incredible amounts of talent, but with that comes so much pressure. And then the social media aspect of just like trying to make sure that everything looks perfect when it doesn't have to be.
I know. And I think too, this is an important thing that noted in this study was that actually female athletes, NCAA athletes, have more episodes of depression and anxiety than male athletes. And then of their counterpoints who are not athletes actually. And so I think that also is just mindful of on the outside, they might have this appearance that they've got it, cool, calm, collected, but we really don't know what might be going on inside.
So my next question is for anyone that this might be resonating with, what is your advice of where to turn if you're on a college campus, if you're maybe hesitant to reach out for help? What is your advice?
So I think talking to any sort of adult, so whether it's coaches, whether it's counselors, academic advisors, professors, also family members, if that's what you feel more comfortable to, primary care doctors, if you have a mental health care provider, those are important outlets as well.
How much do you think these athletes have that kind of support network built out for them on campus, or how much of that work is left to be done?
So I know schools, NCAA as well, they're trying a lot to implement these in place. I know a lot of sports teams have their own sports psychologists on staff. They are setting up these athletes with individual therapists as well. So they are really trying to monitor this and provide support for these people.
You think about some of those really big names and they're kind of like heroes and famous, but at the end of the day, if you look at their age, they're so young.
Yeah. And I think that's remembering too, like developmentally, like they're not still even a fully formed adult yet, so.
All right, well, this is really highlighting an important study and hopefully start some really good conversations as well. We really appreciate you coming by.
Thank you so much.
We also want to let you know that if you or someone you know needs help, you can contact the Colorado Crisis Services. This is at any time. That number is 1-844-493-8255. You can also text the word TALK to 38255.